to increase vaccine uptake. Sorry. So IFRC over the years has developed a lot of different tools and methodologies and approaches, and we've learned a lot from different responses, from the Ebola response, of course, and other humanitarian crises on how to better collect and analyze community feedback. Of course, over the course of the past year, we've adapted a lot, some of these tools for the COVID-19 pandemic, and we are also adapting them now for vaccines as well. So we thought it'd be interesting to bring together IFRC and of course UNICEF as well, who has been working for, of course, a long time on immunization and vaccines and social listening, to look at the different tools that the two organizations have been using, and potentially how these tools complement each other, and how maybe we can learn from each other's tools, use each other's tools, and eventually perhaps even use the data that we are each collecting to analyze it and bring it together for better aggregation analysis to really help us in informing the work that we all do for better community engagement. So I'll leave it to this for now, and I'll just walk you through quickly to our very simple agenda today. So first, we're going to have Eva Erlach, who is a consultant with us at IFRC on community engagement and accountability. Eva has several years of experience in Africa, where she's worked with IFRC, especially on the Ebola response, and where she helped set up a very comprehensive community feedback system. Prior to that, she worked as well with Ground Truth Solutions, and she will be presenting specifically on our community feedback tools. And then we'll have Angus Thompson, who's a senior social scientist with the Demand for Immunization team at UNICEF, and he has extensive experience in developing global program and research, specifically looking at adherence to vaccination and public engagement. And he's co-led UNICEF's Vaccine Misinformation Management Field Guide, which he will tell you about a little bit later. And then, as Monica explained, we'll have quite significant time for Q&As, because we want this session to be interactive and ensure that we answer some key questions that you have or concerns, and how we can better use these tools, or perhaps even improve the tools that we currently have. So without further ado, I'll just hand over to Eva for the first presentation. Off to you, Eva.
Hi, everyone. And thanks so much, Alex, for this introduction. And thanks so much for having me. Really excited to be here with you today. I'm stopping my video now, but I just wanted you to see who is talking. So I'm sharing my screen. Can you see it?
We can see it.
Great, yes. Perfect. So let me just jump into, so what I'm going to talk to you about today is the tools that we developed for systematically listening and responding to communities, and other tools and resources that the IFRC has put together specifically for the topic of vaccine uptake and vaccine hesitancy. So really excited to be finally sharing this. We've been meaning to share this for a long time. We've kept adapting and tweaking them. So today is definitely a big day for us to be sharing all these resources with you. So what I am going to talk about is, first of all, I want to clarify a bit the link between community feedback and vaccine uptake. And then I will present some of the highlights of a vaccine resources pack that we have put together, and I will focus most on the tools that we've developed for collecting, coding, analyzing, and acting on community feedback. Before I will then share our experience of developing these tools and piloting these tools in the Africa region. Yes, Alex already mentioned, I used to work with the IFRC in the Africa region for some time, which is why many of my examples come from Africa. So why do we actually need to systematically listen to communities? If we do not listen to communities, we might end up in a situation where we talk about the necessity of wearing masks to protect ourselves. We might be repeating messages such as such as the importance of calling a hotline if someone is showing COVID-19 symptoms, and keep repeating the importance of making sure that we get vaccinated, we and our families get vaccinated once this is possible. But at the same time, communities might be talking about face masks being poisoned or infected with the disease, or they might be afraid of going to the hospital because there are rumors that if you go to the hospital, you will be kept there and you will be injected with the virus. Or there might be rumors that vaccines are actually just a means to kill lots and lots of people, that they are poison, and that you should never get vaccinated. So if we are not listening in a systematic way, we might not be aware of all these rumors and fears of community members. If we repeat our same old messages, this will lead to frustration of communities. They will ignore health advice because it does not correspond to their information. They will, because they won't trust any of it. And they will then not adopt safe practices because they don't believe in the disease, or they won't listen to the health advice that we are providing. And this means that they will not participate in the fight against COVID-19. But we all know that an epidemic can only be ended by a community themselves. It's communities that end an epidemic by protecting themselves and by adopting positive health behaviors. So what is the link between community feedback and vaccine uptake? So the community feedback helps us to ensure we focus on the right topics in our risk communication and community engagement efforts. It helps us to tackle rumors and misinformation, but it also highlights communities' capacities and suggestions. Communities might have great suggestions on how to roll out vaccines, on how to reach everyone, and how they can contribute to this effort. Community feedback also shows us where problems lie, what is not working, and it helps us improve in real time to make sure that we act on the things that are not working well, and change our direction and adapt our interventions. And it also helps us to highlight cases of fraud and abuse, as well as that it can reduce the pressure on our volunteers. If there is a systematic way and a mechanism in place for tracking communities' perceptions and questions and complaints, it is easier for our volunteers to handle difficult complaints or questions, to respond to communities, making sure that we can make sure that volunteers have the information they need to address concerns and answer communities' questions. And all these activities together help us build trust, because we all know that trust is key in ending an epidemic. But we also all know that that's very difficult to gain trust of communities. And what we've seen in current and previous epidemics is that in order to gain trust, we really need to understand the context we're working in. We need to understand community structures and their specific needs and the information that they need, and we need to engage them in a meaningful way, and make sure that there is a two-way dialogue, that we are in regular contact with them and are aware of what their suggestions, what their concerns and questions are. And then we need to act on this information. It's not enough to have a system in place to be aware of the feedback, but we need to show how we are listening to communities and working together with them. So an important part is also to accompany community members, to be part of the solution, to participate in the response efforts. And this all is easier said than done. And this is why we need lots of guidance and resources to make sure we all have the tools and means to systematically track community feedback and to gather the information that we need. So specifically for vaccines, I4C has put together a resources pack that I will present to you. Or actually, I will present some of the highlights with you because there's lots of stuff in there. So the things that I wanted to point out to you are a behavior change framework, which comes with core questions and indicators, then also a recommended survey, so a recommended questionnaire for conducting surveys on vaccine uptake and hesitancy. Then there's also an FAQ specifically for vaccines for our staff and volunteers. And there is a new COVID-19 community feedback package. It's actually not new, but it has been revised and repackaged, and I will focus on that the most before telling you a bit more about these resources. So the first resource that I want to highlight is a behavior change framework. And it's a great resource. It was developed by the Risk Communication and Community Engagement Collective Service. So not just I4C, but UNICEF, WHO, and GORN. And it is linked to the global RCCE strategy, and it provides 6 dimensions. 6 dimensions that are most relevant for understanding the impact of communities' perceptions, of social and structural variables, of communities' knowledge and practices on the uptake of positive health behaviors. And in order to understand these dimensions and in order to collect the information that we need to understand these dimensions, there is a question bank. So this is really great. It provides, it's an Excel file that provides the indicators and example questions for collecting information on these 6 dimensions.
Sí, la mayoría de los que venden no da para el 5G.
From this question bank. So these are general questions, general indicators and questions, but they also include vaccine specific questions and indicators. And there's also a recommended survey for vaccine uptake and hesitancy that I4C has put together. This can be used for individual interviews, and it can also be used for Red Cross and Red Crescent staff and volunteers, as well as key informants. Then there is the vaccine FAQ that I mentioned, that it makes sure that that staff and volunteers have simple and clear answers to all kinds of questions relating to vaccines. And there is the community feedback package that was developed for COVID-19, and it covers 5 steps. The steps of setting up a feedback mechanism, of collecting, coding, and analyzing community feedback, as well as then acting on the feedback. So translating the community feedback into concrete action. It comes with a training package, so there are PowerPoint slides, resources for group exercises, an agenda, and all kinds of other resources, templates, tools, and I will mention some of them. So for setting up a feedback mechanism, we have a training session, which is an introduction to listening and responding to community feedback. This is also related to our community feedback starter kit, which is included in the package. It's an I4C resource for that provides general guidance on setting up a feedback mechanism. And there's also a guide that I want to point out that helps you to set up mechanisms using perception surveys. So that's also a great resource when using perception surveys. Then for the collection of community feedback, there is again a training session, and then there are tools such as a community feedback form and a Kobo tool. So the same form set up as a Kobo tool if you can collect data using mobile devices. A simple Excel log sheet for managing the community feedback. And then of course also the recommended survey questions for vaccine uptake and hesitancy that I already mentioned. So here we can see the community feedback log sheet. You can see that it's a simple Excel file that can be used with drop-down menus to make sure that the data is entered in a consistent way. And why are we using Excel for many of our tools? The reason for that is that we wanted to come up with the tools that are most useful for our staff in the fields, using the software and resources that they already used to using. This is why we came up with these simple tools using Excel. They're not that simple, but they are, but they can be used by. So what I'm trying to say, they are simple to use, but not the development was not that simple. Then for coding of the community feedback, a lot of the feedback we are receiving is qualitative data, and often we are struggling to really organize the data, to make sense of the data and code it. So there is a training session that walks you through the process of coding qualitative community feedback data using our tools. We developed an Excel analytical tool for coding community feedback data that is working with the coding frame that we developed together with the US Centers for Disease Control and Prevention, so with the behavioral science team of the US CDC, which we've worked with closely for the past few years. And so we took the coding frame that was developed for the Ebola outbreak and for that community feedback system that we set up during the Ebola outbreak in Eastern Congo and adapted it to the COVID-19 response. So this is included there as well. And there's also a simple manual for coding the data using these tools. So here you can see the part of the analytical tool that can be used for coding the data. So here you see how like if we have one community feedback comment, we can go to the coding frame, which provides the description of the codes and example comments. And we can go there to find the right code, like the category and code, and choose the category and code using our drop-down menus, which then adds the indicator and research question automatically. And then the next step, once we have coded the data, we also need to analyze it and make sense of it. So there is a training session for that, for analyzing and reporting on community feedback. Then the Excel analytical tool can also be used for analyzing the feedback, which I will show you in a second. And there's also a Word template for producing a simple community feedback report using that tool. So again, this is the Excel analytical tool with all our data, which includes a dashboard, like a simple dashboard using graphs and pivot tables where you can filter the data that you have included in your dashboard. Then there is, then this dashboard also provides the topics that were shared in these locations. And there's also a dashboard providing the option of looking at trends over time. And then again, showing the feedback topics and codes that were collected during that period of time. So you can use the filters for really looking at what you are interested in. Are you interested in a specific area, or are you interested in the trends overall in a certain period of time? But then being aware of the feedback is not the end of the story. As I have pointed out before, the most difficult part is often the action on the feedback. So we have a training session on that as well. How do we make sure that this feedback leads to concrete action? Then there's also an example action tracker on community feedback, which can be used for discussions of the feedback, and then assigning roles to different people and following up on this action. There are also TORs for an interagency community feedback working group that we set up as part of the COVID response in Africa, together with UNICEF, so in East and Southern Africa, as well as West and Central Africa. There are these interagency community feedback working groups that have the aim of triangulating the main findings that organizations are seeing in their feedback, and to discuss joint action. So there are example TORs in this package as well. There's also a community-led solutions package which includes webinar recordings and guidance on how to work together with communities to identify solutions that can be led by them, that are appropriate to them, as well as a package for addressing mistrust and denial of community members, again with infographics and webinar recordings and guidance. So all of these resources, which are a lot, have been developed in the last few years and months, and a lot of them go back to what we did and what we piloted in the Ebola response in Eastern DRC. There we set up this broad mechanism in the beginning of the response, which was in 2018, and volunteers started to collect community feedback during the social mobilization activities, using paper forms because there are very few people have access to mobile phones. Network is really bad, so there we really had to come up with the most basic system possible. And this turned into the biggest community feedback mechanism during an epidemic. Over the period of 2 years, or about 2 years, more than 1 million feedback comments were documented during face-to-face interactions and then analyzed. And this feedback data was analyzed on the local level. It's still being analyzed, so that the feedback system is still up and running now in Equateur, in DRC now, after the 11th outbreak in Equateur in DRC, and the findings are then shared with internally as well as externally with the broader response. So on a regular basis, this feedback was analyzed, coded, analyzed, and shared with everyone involved in the response. And what we piloted there is something that I mentioned on the previous slide. We set up interagency community feedback working groups to make sure that we are not only using this information to adapt our messages, but to make sure that we are sharing this information with everyone working on the response and discussing with the other pillars of the response, such as logistics, security, the burial teams, to discuss these findings with them and to think about solutions for addressing the feedback and for taking that feedback into account. And then COVID-19 started. And right in the beginning, it was clear that it was necessary for us to really understand communities' perceptions and come up with a mechanism for with a mechanism that is based on appropriate and simple and realistic ways for collecting and documenting community feedback. So we work together with the national societies to identify which channels are already used, what is already in place, and how can we integrate a community feedback component. So we looked at what we used for the Ebola response. We adapted it and developed guidance and templates for our colleagues on the country level to document the community feedback that they are collecting and to identify new ways for collecting feedback. And the process that is still ongoing, that is still in place, works as such as that the national societies then share the feedback data on a regular basis. And we already also started a capacity building process for national societies to be able to code and analyze their own data. So now this information is analyzed on the local level as well as on the regional level, and regular feedback reports are produced that are then shared again internally and externally, and so internally with the different technical teams, and externally in the community feedback working groups that I mentioned before. And there are some examples of concrete action on community feedback that I wanted to share with you. So the first step, that is usually the easiest step, is to adapt the information that we are providing. So when we produce all these feedback reports, we see what the main rumors are, what are the main questions, and we need to make sure that our staff and volunteers know how to address this information, know how to tackle rumors, and how to provide the information that communities are asking for. So we started producing these fact sheets that are called Ask Dr. Ben or Ask Dr. Isa in both English and French, where we focus on the most recent and most frequent issues and provide simple and clear answers for our staff and volunteers that are then shared widely. And we also started producing videos with the same concept, again, featuring our health colleagues, such as Dr. Ben, who is our head of health and care in the IFSC Africa region, tackling
Can you catch COVID-19 from hospitals? Hospitals are doing everything they can to keep patients, visitors, and staff safe during this pandemic.
And then he goes on explaining that topic more in detail. It's short videos that can then be shared on WhatsApp and social media. So it's shared a lot by our volunteers, our colleagues and volunteers, to make sure that they have the information, and also for them to be able to share it with community members. And what I wanted to point out is that like the first videos, they were recorded using just a mobile phone. So what we're doing is also to encourage our colleagues on a country level to produce the same type of content, but in a contextualized way, looking at the specific issues in their country. So to replicate same sort of content. And then another example I wanted to share with you is an example for changing what we use or what we provide. So changing the way we are working. In Eastern Congo, one of the biggest issues in the beginning was communities' fear of the burial practices, and there were a lot of concerns about the body bags. Community members thought that it would not be real people that are buried. There were rumors that dead bodies would be mutilated. So this is why after discussions of this feedback and after thinking how we can react to that, it was decided that body bags would be procured with a transparent window. This enables the teams to open the body bag, to open that window, and for community members to see that it is indeed their loved one that is being buried. And this combined with demonstrations and lots of targeted risk communication and community engagement activities was really successful to increase the trust in the burial teams and in this process. And also changing who we work with is can be an important action on community feedback. Again, an example from Eastern Congo, where motor taxi drivers were a key resource, a key source of rumors and resistance. And once we realized that that there are these issues that were really targeted by our social mobilizers, and in the end, they were the ones who were tackling rumors. They were the ones who were providing health information, even joining coordination meetings as partners in the response. So this was a really successful way to bring them into the response and work together with this key group. And then also advocating for change. When we receive this information, we also need to make sure that we are advocating for this to be addressed. One of the common concerns of community members that have been shared in the past months were criticism of politicians and police and military for not adhering to physical distancing and not wearing face masks. So what the Red Cross in South Sudan did was to share this feedback with the police and also conduct health promotion sessions with them, providing them with face masks and discussing their special role as role models in the communities. So where can you find all these resources that I mentioned? Everything is publicly available. You can access it on the Community Engagement Hub, and it's also accessible in the IFRC Prepare Center. This is all from my side, so I'm handing back over to Alex.
Thank you so much, Eva, for this. I know there's a lot of questions in the chat about if we will share the slides, the recording and all the tools. Yes, we will. Do not worry. We will send a follow-up email to all the participants of this webinar with the recording, with the presentation and all the tools that were talked about for now. So we're not going to get to questions just yet, if that's okay with you. If you can just keep your questions. I mean, obviously you can put them in the chat or keep them for a little bit later. We're going to go straight to our colleague at UNICEF, Angus Thompson, who I introduced at the beginning of the session. But for those of you who logged in a little bit late, just to let you know that Angus is the senior social scientist with the Demand for Immunization team at UNICEF HQ, and he co-led the UNICEF Vaccine Misinformation Management Field Guide. So he will be telling us a little bit more around all the work they've been doing on social listening. So Angus, off to you. Thank you.
Thanks, Alex. How long do I have?
You have about like 20 minutes. Is that right, Monica? Like, sorry, I'm not looking at the time.
That's fine. Yeah. I can talk for as long as
we'll stop you otherwise.
Sorry, folks, I'm panting. I just ran downstairs because I'm educating children at home. Same time as working in an office upstairs. Thank you very much for the invitation. I'm delighted to be here. My name's Angus Thompson. I've been working on the behavioral social determinants of vaccine acceptance and uptake for something like close to 15 years now. I've particularly focused on adult vaccination over that period, which is a bit of a gap that we have at the moment in the literature, and which is particularly relevant for COVID-19. But when I landed at UNICEF at the beginning of the pandemic, I was asked to set up a social listening program to support countries to implement social listening. I've done this kind of work at a global level a few times before. I set up a social listening dashboard for vaccines back in 2013-14 with Children's Hospital Boston and Harvard Medical School. Unfortunately, at that point, the vaccination enterprise wasn't that interested in social listening, so we couldn't find anyone to use it. I've also had worked on a large project with Google using big data to understand the determinants of vaccine uptake. And I mention that because I brought this kind of experience to this UNICEF request to set this up, but I've always carried a very important kind of caveat when I've worked in this field, which is we can do a lot with online data. So we can access vast amounts of online data. We can make sense of it through machine learning, artificial intelligence. If we can clean the data and aggregate it in a single data lake, we can do all sorts of things with it to make sense of it. But of course, as you've just heard in that excellent presentation from Eva, what a fantastic package. There's a whole lot of insight, of feedback that's not necessarily coming through digital channels. So I set about bringing together a partnership of organizations who I thought were really at the forefront of the different aspects that would compose a misinformation management program. We lost my slides. And at the same time, wanted to think through how it would be possible to set up a system that would allow a country to aggregate both online and offline data. So today I'm going to just spend a few minutes on misinformation, disinformation. And I'm not sure how many amongst us have worked on vaccines before. I may give you one or two words on vaccines, just to kind of set the scene. But what I'd like to then do is just give you an introduction to the misinformation management field guide that we've developed, that really aims to be a strategy setting document. I mean, there's a lot of evidence grounded background, but a strategy setting document that would allow partners in a country to build a connected workflow for misinformation management that obviously must fit in with everything else that we're already doing, and most importantly for us, should closely couple the social listening that is possible with the RCCE work in the field. So our next slide, please. So I saw on one of Eva's slides, I think infodemic on the framework there. This is a language that the WHO started using that is probably helpful because at least it gives us a lead on how we might take a structured scientific approach to understanding and managing mis and disinformation. With one of our partners, Public Good Projects, which is a not-for-profit in the US, who have been doing social listening online social listening since the beginning of the pandemic. We detected over the period March through December last year, a greater than threefold increase in English vaccine critical messaging. And that's, that represents something in the order of 15 billion views. So we do know that mis and disinformation in relation to vaccination has increased, at least online. We know that vaccines have forever been a magnet for mis and disinformation. Listening to Eva's presentation, it just made me think that perhaps two words on what we know, or at least what I know about in particular the behavioral determinants of vaccine acceptance. We often come at this problem focusing on the vaccine and therefore talking about the benefits and the risks, vaccine safety and vaccine efficacy. But what we know is that people's decisions around vaccines often run very deep. and that universal moral values, there are a couple of universal moral values that may correlate with people's decisions. There are there are certain worldviews, certain beliefs, etc. So it can run quite deep. Trust is the bedrock of vaccine acceptance. In fact, the more I think about this, the more I think that, in a sense, acceptance of vaccination in any context is almost a proxy for the level of public trust in the health services, but probably more broadly in the government that's delivering them. So please keep trust in mind as one of the most important objectives of any kind of work that we do to counter mis or disinformation. Next slide, please. Monica, could you flip to the next slide, please? Or Alex?
I just did. And the next.
Okay.
I think there's a problem. Yeah, we're seeing.
Can everybody see it, or is it me who's locked up?
No, I can't see it either.
Okay.
It
I'll
just
keep
says
talking.
Monica has started screen sharing. I don't know if it's on your end, Monica.
So while we're waiting to see if my slides can be brought back to life, just a very quick definition. So as we saw in the framework that Eva presented, information is important. It's never sufficient to get people to adopt a behavior. It's often the solution. We throw it over the fence and wonder why people don't do what we would like them to do. But it is certainly, when it is reliable, considered to be reliable, so coming from a trusted source, a trustworthy source, when it actually speaks to people where they are about what matters to them, as opposed to what we often do, which is telling people what matters to us, then it's very, very important. And in social listening, online, more important than detecting mis and disinformation narratives that may be circulating is the detection of information deficits or information gaps. Because if people can't find the information that they need, obviously that leaves a vacuum for the mis and disinformation, and leaves their questions unanswered. Misinformation is false information. It can be confusing. It can be distracting for people. Would you like me to try to share my slides? I've got them open. Alex?
Monica's writing to me on the side. She completely lost her network connection. That's why. So she's trying to send me the slides. So if you have them,
but I've got them open. Can I just? Yeah, I can share. Let me just do this.
There you go. It's much easier. Sorry about that. She lost her connection.
That's okay. Can you folks see that? I just
Yes,
quickly saw
great.
a flash. Can you define social listening? I'll come back to that in a second, please, because it's a fundamental question. Yes. So information also has to be actionable, right? And it has to be what we call sticky, or psychologically sticky. And a lot of misinformation, and in particular, its malign cousin disinformation, is very psychologically sticky. So misinformation is unintentional falsehoods. Disinformation is deliberately engineered falsehoods. This is misinformation that is designed and disseminated using deceitful tactics with malicious intentions behind it. And a lot of what we're seeing in relation to vaccines before and during the pandemic is actually disinformation. And this is important because, one, it's engineered to stick in people's minds, even when we think that we've corrected it. It's engineered to spread more rapidly than information. But this distinction also gives us a key insight into how we might address these rumors, so disinformation, but also misinformation more broadly. And I'll come to that at the end of my presentation. So just a quick definition. It's sticky. Everyone can have these slides. I don't want to go into great depth, but what's important is that even when people understand the correction, believe it, and even can remember it, the misinformation may stick. And that's for various reasons. One is that it's often it triggers fear, which can backfire, often because they see it more than they see the reliable information. And we naturally confuse familiarity with truth. This is an interesting psychological phenomenon. As Daniel Kahneman said, a reliable way to make people believe falsehoods is frequent repetition, because familiarity is not easily distinguished from the truth. I think the last point, and I think this is no news to you on this call, but is an important point that I make with people who are looking to potentially develop online community engagement programs. Our truths come from the trustworthy, and with vaccination in particular, the information source is fundamental. And when we say trustworthy, that doesn't just mean expert. It doesn't just mean credible. It means someone who's concerned, who we feel is concerned about our well-being. So there's misinformation, but misinformation sticks and thrives in a context of mistrust. Therefore, if we want to manage this, we need to, at the same time, be constantly thinking about how we build trust or diffuse that mistrust as well. These are intertwined, interrelated, and therefore we must be thinking about the two all the time. So 2 more points about misinformation, and then I'll get to the guide and what we have in there. This was an interesting study. This is a social network analysis of Facebook pages in English, where they tagged pro-vaccine pages, vaccine critical pages. So pro-vaccine in blue, vaccine critical in red, and what they called undecided pages where there was no position taken. There are many conclusions that can be drawn from this paper. It's an interesting read, but the takeaway for me was that the anti-vaccine pages, accounts, are reaching the undecided more effectively than the pro-vaccine pages. So the pro-vaccine pages are basically talking to themselves. The anti-vaccine or vaccine critical pages are reaching the undecided. And that tells me that they are working from a strategy. They're thinking through what they're doing. They understand the dynamics of social networks online, and they're using them to their advantage, whereas these pro-vaccine pages simply aren't, as far as I can see, it's the old throw the information over the fence model still going on online. Therefore, we need strategy. If we want to address misinformation, both in the short term, in this infodemic, but also over the longer term, we need to work from a strategy. We can't do this in a haphazard, random approach, just as we do in so many of our other activities. So we brought together 5 partners, each of whom brings a different strength to this partnership. And our objective is to provide a package of tools, training, technical support, whatever a country would need to start to build capability in social listening, but most importantly, equitable social listening. So online and offline social listening. And we are very much focused on bringing it to country level. There are a number of initiatives doing this at a global level, tracking dis and misinformation at a global level. That's important because we do see that some of these stickier, well-engineered rumors travel fast and wide and stick in different countries, but it doesn't give us any of the nuance or sophisticated insight, contextual insight that we need to be able to understand and address those rumors. So we're looking at there'll be some global monitoring, but our focus is on developing local level social listening. And our third objective, there are dashboards out there everywhere, at least doing media monitoring and social media listening. There are lots of dashboards. The problem so often is that they're not one, being read properly to produce the kinds of actionable insights that teams in the field need. And so we want to see how we can join all of this up. So there are three pillars to this, this initiative that we're calling the Vaccination Demand Observatory. We're developing, and I'll come to this in a second, and this will also answer the question about at least my definition of social listening, a platform that will be customizable for countries. So there are a lot of commercial social media listening platforms out there that do an average job. They access some channels, but is Twitter an important channel in the countries you're in? Often not. They're expensive, they're proprietary, they require subscriptions, etc. And most importantly, and I'll come to this in the next slide, they're limited in the data streams that they can access. And what we want to develop is a tool that would be able to access different data streams, even the offline data streams that Eva was referring to. We're looking at solutions for that. We want to, at the center of this program is the infodemic manager, what the WHO calls the infodemic manager, the person who does the social listening and analytics on a day-to-day basis and provides those actionable insights, provides monitoring and evaluation support, has some behavioral, social science background to be able to provide those insights, etc., etc. The WHO has started training infodemic managers. We want to see whether we can develop a program that will embed them in countries, much like the field epidemiologist training program. And then the third piece is what we're calling the Digital Interventions and Assessment Lab. So we're looking at how we can set up a system that would allow rapid design development and rapid testing of messages online. One of the advantages online is that you can do this. You can do rapid A/B testing, iterative testing for both efficacy. I mentioned safety there because we know that vaccine communications can backfire rather spectacularly. And so they're the three pillars of what we're developing. And I'll get into a little bit of detail about those and show you some of the deliverables that we have before I get to the guide. We've, with Sabin, had organized 3 webinars. So you'll see a lot of what I've been talking about in more detail in that first webinar, plus a really great case study from my colleagues in Pakistan, Claire Wardle and Saiful Islam talk about infodemiology in practice. How do you really dig in and understand what's going on? And we can probably vaccinate people against misinformation. So myth busting doesn't work. We know that, especially with vaccines, but there are different ways of addressing misinformation. And Bright Simmons and Steve Lewandowski and Lucy Kanja talked about, in particular, Steve discussed specifically how we can inoculate people against disinformation. This is in the guide as well. We've given a number of links, and I might just come back to that in a second. So this is the guide. No, actually, before I show you the guide, I just want to address that question. So the question was, what is social listening? And I think that's a great question. I think it's often confused with social media monitoring. That's what I often hear, and I think that's probably what I was tasked with. But there's so much important feedback being gathered out there, either through mechanisms that you're involved in and that Eva presented, but also through non-traditional digital channels, such as, well, for example, YouReport that UNICEF has, other channels like that. Every country has different potential sources of information that may be digital and online, may be offline, or may be coming from on the ground. And so our objective is to develop a system that would allow a country to aggregate all of this and actually start to make sense of it. And we now have the power to be making sense of this kind of big data through machine learning, as I touched upon, through algorithms, artificial intelligence that can help us sort through it, to help that would visualize that in dashboards, collate the misinformation in rumor logs. And I'm really excited seeing that community feedback analytical tool, and I want to think about how we could bring that in as well. that would feed those insights recommendations for the field, and also hopefully set up monitoring and evaluation, at least on digital channels, but why not offline as well? So the principle really is social listening in its largest sense, but using the technology without to consolidate all of that data, all of those insights, without being limited by the technology, which is where I find we often land at the moment. So the guide, my objective in developing this guide was to provide a something that would allow so strategic planning, development of action plans, would help countries to join up all of the pieces in this workflow that's needed if we're going to do this effectively and have the social listening coupled with the analytics and intelligence, and that being coupled with all of our engagement activities. It's available online. The link is there. It's available in English and French at the moment. We've just been correcting last corrections on the Italian version. If anybody could help me do a final check of the Arabic version, I would be forever grateful. I'm struggling with that. We've got the translation. Spanish is almost done as well. And at that link, you'll find one of those webinars that I mentioned as well. So what's the point of this guide? How does it work? The point is really to provide an operational framework that would just make sure that we're not missing any important steps in setting up a program. And by that, I mean, obviously there's preparation. You don't just get a dashboard and start plugging in keywords. You need to get the partners around the table. You need to understand your information ecosystem. Where are the conversations online and offline? What are those conversations? Who's having them? Where are those communities? What channels are they on if it's online? Who are the influencers in those conversations? What are we already doing to understand and hear those conversations? Then you build out the system. We're starting with, it's a bit more quick and dirty. So we're using TalkWalker dashboards to get things going. We're in the process of developing that broader system. We hope to have that ready in a few months. And then basically we suggest like 3 big phases. So you start the social listening, you pick up the misinformation, and because today we're talking about misinformation, that's what's on this slide, but also you detect those information gaps. That feeds a log where you start to track the rumors, the misinformation that you're detecting. You verify it and assess it for action. You make sense of it, and then you provide hopefully actionable insights for the RCC teams, the comms teams, whoever it's relevant for. And at least the online monitoring gives you options for kind of continuous monitoring and evaluation, but we'd want that offline as well. Just briefly making those decisions. Where are we up to? I'll take another 5 minutes if that's okay. Monitoring those decisions, making those decisions is important because we don't want to address misinformation if we don't think it's going to get traction and have an impact. Because by doing that, we can potentially give misinformation that would otherwise just disappear naturally oxygen. We can breathe on the flames. So we want to identify the information gaps on the right, and we want to take the lead to really shape the conversations, the agenda, to make sure that the content is out there that people need, answering their questions, answering their concerns. We want to raise the trusted voices, not just the ones that are already, for example, in some of the online networks, but can we bring in new voices to those networks, new trusted voices? So for example, I've developed for the International Pediatric Association, a training module within a broader program that they have that trains health professionals to get into social media, just to get in there, to get into some of the channels and to start to have a voice, because we know they're such trusted voices. If you've got misinformation, you need to evaluate it. Low risk misinformation, track it closely, and we can pre-bunk that. Medium or high risk, we can debunk. And I'll tell you now what I mean by that in the next couple of minutes. Pre-bunking is predicated on the notion that I think is probably a universal human value, but don't quote me on that. I'm not sure I found the psychological research yet. A fundamental human value that we all share, which is none of us likes to feel like we're being fooled or tricked, having the wool pulled over our eyes. So we can make people aware of those deceitful tactics and, in fact, the malicious intentions of the authors of misinformation, disinformation. And in doing so, we can develop a generalized immunity against misinformation. So for example, that game in the middle there is an adaptation of a game. So it's been focused on COVID-19, but its precursor was tested in a couple of randomized studies that showed that playing that game where you play the role, you put on the baddie's hat, you play the role of the disinformation author, and you choose your tactics to fool the idiots out there online. Playing that game actually for not a very long time, I think it was 20 minutes or 30 minutes, increased significantly people's resistance to misinformation, and importantly, their ability to detect misinformation. So a piece of this, probably the first piece, is just the red flags that we should be picking up on, that at least a signal that we might be reading and, most importantly, sharing misinformation, and then getting in depth, understanding the tactics, seeing that we're being fooled. That can inoculate us. And I think that there are tools, courses, curricula, including the informed health choices, which was tested in a cluster randomized trial in Uganda and shown to work, that we could be employing immediately to start to build community level immunity against misinformation in general. One study on Twitter, okay, I know it's Twitter, and the reason all these studies are done on Twitter is because Twitter gives us access to their data. But one study showed that 60% of everything that people were sharing had never been clicked on. So people are blindly sharing stuff, and therefore they are effectively blind spreaders or super spreaders of misinformation, unwittingly or not. And what this means, what this kind of approach means, is that we can remove those super spreaders from the circulation by giving people these critical thinking tools. When we have specific disinformation narrative, rumor that seems to be getting traction, the classic myth busting, vaccines don't cause autism, we know is not necessarily effective and may actually backfire. A couple of studies have shown that when you lead with something like that, a very high percentage of people a few hours later remember vaccines and autism, and they don't remember the don't cause in the middle. This is the current formula that is being proposed. I'd encourage you, if you're interested in this, to download the debunking handbook. I worked with one of the authors, John Cook, on this disinformation guide that we have, but the debunking handbook goes in more detail. We're currently working to develop debunks and prebunks again in relation to COVID-19 vaccines. But essentially, this current formula that we think, this is at least what the evidence tells us is most likely to be effective, is as follows. We lead with the fact, but hopefully we make the fact as sticky as the misinformation, because we spend a bit of time thinking about how we frame it for our audience. We provide people with a warning, there's misinformation coming. We may provide the misinformation, but we try to do it in a weakened form. That's like the antigen in the vaccine. We can also warn them that there are misleading tactics coming, and then we show them those tactics being used to deceive them. We highlight those, and the aim here is to undermine the trust in the content that they're reading by undermining the trust in those who created it. We can also, and there's a taxonomy of misleading tactics used in misinformation that's been developed primarily from climate change research, but also other science denialist research. And I think we've already got a framework here that we can start to use, but this will be improved with time and perhaps more targeted to vaccination. But what we do see in particular with vaccines is there is often a hidden agenda, right? The biggest one, quite frankly, is monetize. So there's a lot of money being made. The Centre for Countering Digital Hate in the UK estimated that it's $1 billion industry in English language. Vaccine misinformation, disinformation is used to politicize often. I'm sure all of you can think of an example where you've seen that. And we have examples of state actors using it to polarize societies in broader strategies. We provide we highlight that
quickly,
fallacy.
Angus, if I can ask you just to wrap up, because we have about 20 minutes left and
Sure.
there's a lot of
And then we
questions for
finish
you
with
as
the
well.
facts. Thanks
Yeah,
for
so
reminding,
just,
and then we finish
sorry.
with the facts.
Go ahead.
The last thing in 30 seconds, and then I'll shut up, just to show you how that lab works. So in Liberia, we identified through social listening important gaps in information, but also multiple rumors, one of which we flagged as medium risk. We reverse engineered from the content that was already being shared. What was the format? What was the look? What were the colors? We forward engineered from the behavioral science. We based it off the pre-existing NOPV2 messaging. This was focused on the new oral polio vaccine, and we developed content that we're going to test. We also created a pre-bunk below, which doesn't mention the myth at all. I'll leave this for you to look at. We'll share these slides with you. We've done other work in Congo and Ivory Coast. So in conclusion, the guide's available to manage misinformation. Obviously, this is not everything in demand generation, but it should be an important part of a demand generation strategy. And it's often a missing part. So it needs to be strategic. It needs multifaceted, coordinated actions. We can vaccinate people against misinformation and disinformation. And really, if I left you with one key point, which I think will resonate with all of you, it's that we do get excited about misinformation, disinformation. It is important, but most important is to look through the fog of that disinformation to ensure that we're picking up the questions and concerns that people have, and that we're responding to those in a way that effectively makes people feel heard. Thank you.
Thanks so much, Angus. A lot of information there. So really interesting. And we have a lot of questions already in the chat. Some of them we've been responding to as we've gone ahead. But maybe the first question that came up, which I think is an interesting one, and maybe Eva can answer first and then you, Angus. But the question was, so community feedback mechanism and social listening systems are considered two different namings for the same function, right?
Yeah, I think that's a really good question. The reason I think the answer is yes. The problem is that online social listening, so social media listening, monitoring, and to an extent media monitoring, doesn't have often, for me, the granularity or the sophistication of the offline community feedback mechanisms that many of you are involved in. They pick stuff up. They have algorithms that suggest that it might be negative sentiment or positive sentiment, but you don't get the granularity that I think is fundamentally important if we're to respond to people's concerns, if we're to make people feel heard. So what we're working to develop is a system that would kind of consolidate everything, but also hopefully encourage implementation of social media listening and media listening at a country level, or even district region. You can start to get, whether it's geographical or community granularity, so that you're picking up the kinds of nuances that I think we're able to pick up through the community feedback that Eva was referring to. For me, it's the same thing, but they're often considered separately. And our objective is to bring a lot of that technology that's being used for social media listening to bear on all of these different data sources, to both aggregate them and make sense of them, hopefully in a way that would be more useful, more effective, would provide more rapid detection of signals, and more sophisticated, nuanced understanding of people's questions and concerns. Over.
Thanks, Eva. What do you think about that? And then I have another question for you.
Yeah. Thanks. Thanks for this question. I think it's a really, really good question, and I'm really glad to hear Angus say that, or like to hear Angus's comments, because I think we're very much on the same page. And I think it's just also something that is new, and we do not have, as far as I can see, we don't have like a clear definitions of this is social listening and this is community feedback. So I've been hearing this question a lot, and as far as I can see, like social listening is more looking at what is happening in communities, what are the discussions, what are communities saying and feeling, and our community feedback approach is a bit broader and it complements each other really well. But like our approach to community feedback is also like opening a dialogue with communities and really making sure that we are finding solutions together with communities, that we are using this feedback to identify community-led solutions for bringing in communities, for finding solutions together with communities. And a great point that we've made in the chat box is also that like a community feedback system really also focuses on how to act on this information, so which is linked to that. So this is what we've been hearing, so what do we do about this? What do we do about this together? So once again, I think it can complement each other really well, and I hope that at some point soon we find a definition that that everybody is comfortable with. But I think this is how I see it at the moment.
Thanks, Eva.
I might underscore what you
Yeah.
said, Eva, and I'm hoping that today is like a step towards a kind of consolidation or integration of these two. I agree with your definitions, but I think we could be doing social listening also is often people think about it as being social media, the digital channels, but I think we should be doing community feedback in those channels, and I think that's possible, and we have some examples, but it just doesn't occur to people to really do that. At the same time, my question is, can we use the power, the computing power that we have for social media listening to consolidate, for example, the data that you're putting in an Excel file at the moment by hand, put that into a data lake and make sense of that, so that we bring that computing power to improve your ability to do the kinds of analyses that you're already doing. So for me, that's how these things might integrate, and I'm really excited to start the conversation today.
Thanks, Angus. And Eva, another question for you that came up during your presentation is from Katie from IFRC. How do you decide when a concern is common or recurrent enough to take concrete action to address it? So how do you, from the community feedback you get, that it's not just a few people, that it's really a community issue and not an individual issue?
Yeah, that's a great question, and this also helps me react a bit to what Angus was saying. I think it would be fantastic if we could work together better and to see to see how this computing power could be used. But I think for us it's also really important to localize this process. So this is what we've seen during the Ebola outbreak, is that we had this huge amounts of data, and we were thinking about, okay, how can we use algorithms to code this data automatically, or we would, in the beginning, we produced more high-level reports, but what we saw was that the concrete action usually needs to be taken on the very local level. Regional analysis is still really important, but the first actions and the most urgent actions really need to be taken on a local level. This is why we started this capacity building approach, and to really make sure that our colleagues on the very local level are able to engage with the data and code the data themselves. And that's why we're using such simple tools as Excel to make sure that our colleagues are able to see, okay, these are the 40 comments that we collected yesterday, and these are the main topics that we were seeing, because it's the local our local colleagues that will be able to have a feeling for, is this something that needs to be acted on or not? Was this just one comment or not? So I think what we also need to take into consideration is that this community feedback can never be the sole basis of our decision making. We always have to contextualize this information, and we need to discuss it further. So this is why it's so important that this information is discussed on a local level, so that we are, so if there is one comment that seems to be really urgent and we don't know, is this something we need to act on, we should check with the volunteer who collected that information, or we should discuss that with key representatives in that community to understand if this is something that needs to be addressed urgently or not.
Thanks, Eva. One last question, and I'll go back to Angus, but there was a question about the resources involved in setting up something like you just explained, like for instance, an Ebola response. How did you use volunteers or paid staff? How many staff or volunteers did you need to set up something like this, and any other type of resources like budget, logistics, supplies that might be needed, so that people don't have to reinvent the wheel? Just have an idea of that. Obviously, it could be a long answer, but if you can give an overview of that quickly.
Also great question. In general, really difficult to say. So for the COVID-19 mechanism, impossible to answer because there's so many different approaches that are being used to document this information. What is key is that for COVID-19, we really, and also for the Ebola response, we use channels that were already up and running. So what I would like to stress is that most of our data is not prompted feedback. It's not that community and our volunteers are going out just to collect this information. It's information that is documented during activities that are already ongoing. So during Ebola, it was our volunteers that are going out to conduct dialogue sessions in households. So they would visit households, talk about Ebola, and then document the key questions, suggestions, and rumors on their form. So it's not just, did you hear about the rumor, or what do you think about vaccines, but like a natural conversation, and then they would document that feedback. So it was, but still to give you some understanding of how many people you would need. So if you have big amounts of data, you will definitely, and especially when you're working with qualitative data, you will always have to have one person that is managing the data, that is full-time, like analyzing the data and making sure that this information is reported on and packaged. So no matter how small how small amount of information is, you need to have at least one person who is managing the process, I would say, and then you can. Like we had more than 800 volunteers in the Ebola response collecting that information, but you can like scale it down. We usually have like 2 people. We had in that operation 2 people visiting one household, and then like 10 people going out together in one community. But really, once again, it's really difficult to mention that. But what I would say, what I would ask you to do is check our community feedback starter kit, because there is an organigram that's the document that our great colleague Viv Fluk, who is also here, that worked on, and there's an organigram to give you a better understanding of how many people you need to set up a basic feedback mechanism. Sorry, now I talked too much.
No, it's fine. We'll share the tool as well in the chat and as well by email. So Angus, back to you now, because there was at least a few people who asked in the chat why, in your opinion, Mythbusters don't work. Can you explain a little bit more of that?
Yeah, it's not an opinion. I try not to have opinions. It's at least what the evidence suggests to me. I had one slide that you'll have afterwards, and I would encourage you to read the guide, which in the first part attempts to consolidate the most recent evidence around the psychology of misinformation. For many years, we thought that there was a strong backfire effect for the reasons I gave you. So when you repeat myths, you increase the familiarity, and we confuse familiarity with truth because a lot of misinformation is engineered. Social networks are built around an attention economy, and misinformation is designed to work within those networks. It's attention grabbing, it's it promises to reveal something to you. It's sometimes alarming. All of these things are little triggers, psychological triggers that get our attention, that encourage us to click on it, that encourage us to spread it. If we spread it, it gets even stickier in our minds. And as I mentioned, it sticks even after we accept that we have been corrected, and we understand the correction. So there are many things happening at different levels, and please read the guide. I mean, I could go back to that slide, but we don't have much time. And therefore, there's increasing evidence that the backfire effect is less important than we thought, but we still don't want to do it if possible. And we do know, at least in vaccination, there are now a number of studies that have tested either misinformation, myth busting, or other content, and they've shown that it's basically ineffective in people who don't, are indifferent or accept vaccines, but in people who have a pre-existing position, who are hesitant, the content actually backfires. And this happens. The communication objective may be achieved. So people may say that the hesitant people in the study said, I'm kind of summarizing this, I understand now that measles is a severe disease. I understand now that the flu vaccine doesn't cause the flu. But their intention to vaccinate their children or to vaccinate themselves went down at the end of the exposure to the information. So there's a lot of things happening at conscious but both unconscious levels, and we're still working through this. Our point in the guide is to say, please at least stop and think before you start going and telling people vaccines don't cause autism. And the other thing obviously is, please don't list 20 myths and bust them, because even if you manage to address the myth that the person was looking at, you've triggered 19 other questions in their mind. But please do read the guide. I think there's a lot more, and it's heavily referenced, so that'll lead you to other cool stuff. And actually, Alex, there was another really interesting question that I've just responded to, talking about the use of levity, of fun, etc. I've shared a game which is like the game I referred to in my presentation, Go Viral. It's called Cranky Uncle. John Cook uses, who's an expert on climate change, misinformation, and more broadly, is also a cartoonist. It's witty, it's funny, but as you laugh, you learn, this is the trick they're using. This is how they're trying to hook me with a conspiracy. This is how they're trying to hook me with fake consensus, etc.
Thanks, Angus. I'll have two last questions for the both of you, and then we'll have to wrap up, unfortunately. But Eva, this one is for you, about a potential stigma among volunteers. So how do you address that if there's potentially stigma among volunteers who are collecting the information? Because obviously they're coming most often from the same community, so they also, might be targeted or have themselves misconceptions and fears. So how do you factor that?
Yeah, that's also a great question. And I think it's very much linked to not just going out to collect information. A lot of times many organizations at the same time go out, ask lots and lots of questions, which frustrates community members. So what the Red Cross volunteers, Red Crescent volunteers are usually doing is they document the information they're hearing during natural conversations where they're not just asking structured questions in a really unnatural way, but enter a natural conversation to find out about how the family, the household is doing. Sorry, now I'm thinking of a very rural context in Africa, but wherever. So I think the key to addressing that stigma of collecting information or being associated with the response is making sure that you use local people, trusted people, and you do not collect information that is not necessary, that you show how you're responding to that information, that you're not just collecting information and people will never hear something back, but if you're working in one community, to also report back, this is what we've been hearing, this is how this is how we are acting on it, or let's discuss what we can do about this. So really making sure that this is not just information extraction, but making sure that this is a full cycle of feedback, where you show how you're listening and where you're using that information that you're collecting.
Thanks so much. And the last question we have, and Angus, maybe you can touch on that a bit, is do you have any advice and guidance? And this is something I've been thinking about for a long time, about triangulating data, this type of data that you're collecting with other technical areas like epi data, for instance, in the case of COVID-19.
Yeah.
Sure, about you. You have some thoughts on that as well.
Definitely. I mean, once you get a platform set up, so a cloud-based platform, what we might call a data lake, it's amazing. You can throw all sorts of stuff in there. You've got to clean the data, but if you have you can set up mechanisms to clean it and automatically feed it. I mean, I was working on with Google. I was working using a Google Cloud platform and their computing power. We're working on determinants of uptake of influenza vaccination, and we were considering all sorts of data. We threw in weather data. We threw in health club membership data. I mean, this was in the US, right? But the point here is the power now, and I'm not someone who's led by tools. I don't get excited by the tools. I think, we should never let the tail wag the dog. But the power that is now available means that these kinds of questions, we can now ask these kinds of questions, Alex. I mean, coverage data, that's the kind of holy grail for me. Can you triangulate against the content that goes out there, the reactions to the content, et cetera, et cetera? The answer is yes. Step by step, though.
Yeah.
I'm a one-man army at UNICEF, so feel free to be in touch with me. But there's only so many things we can pursue at the moment.
Eva, any thoughts on that before we end? No. On triangulating our feedback data with other types of data.
Yeah, we could talk about it for hours, that's for sure. But I think it's incredibly important, and this is something that that we need to do much more of. Very often, our community feedback data is siloed under the communications and RCCE side and not really taken seriously. So I think there's a lot to do to make sure that we are combining our data sources and provide a full picture, and make sure that our community feedback is integrated into broader situation updates, for example.
Yeah. Well, it's already time, I'm afraid. Thank you so much, Eva and Angus. It was a really rich presentation, a lot of information, a lot of food for thought. And so we'll share the recording, as I said, and all the tools as well with everyone. And then also perhaps your contacts, Angus and Eva, if people have further questions or want to work with you in some capacity. We'll maybe share your contact as well. So thanks so much and have a great weekend. And thanks, Monica, for organizing. She is offline, I believe. She was not able to reconnect to the network, I think.
I'm able now.
Oh, you're under another name. Okay.
For all the tech problems, but it was such a great webinar. Thanks so much, both of you, and all the participants for the incredibly great questions. Thanks so much.
Thank you, Monica.
Thanks for having me. Thanks, everyone.
Thank you. Bon weekend.
Bye.
Thank you.
Weekend.